Faith-based communities, churches have always depended upon volunteer labor. They will remain after the agency has gone because they're a part of the community. So there are many distinctives that we were able to talk about that attach themselves to faith-based health, that you're far more likely to have sustainability. So I think this gave a special opportunity, particularly with Ray having a voice there. I remember Ray saying, you know, with the World Bank and USAID, I ran multi-million-dollar programs. I never got invited to where I do now when we have maybe $5,000 in the bank, because there is something very distinctive. One last story. I remember, I think it was an NCIH or Global Health Council conference. Mother Teresa came to speak. Do any of you remember Mother Teresa speaking? I remember. Let's just talk about it. And she was sharing, and in the midst of her sharing, she gave a very pro-life message as well. And at the end, she received a standing ovation, even though most of the people would have gone to the bulwarks to oppose the message that she had given. In fact, I think the young woman next to me had on IUD earrings. But what Mother Teresa was expressing was the character and compassion of the Lord that she served. And that's incredibly attractive and incredibly effective.
Yeah, I feel very humbled to be in the system company, but I'm also very privileged to talk about what I think really defines CCIH's mission, and both Robin and Meredith have spoken of this, but it is our Christian perspective, our Christianness, that compels us. It distinguishes us from other health networks. Being, though, a diverse group, a diverse communion at CCIH, it is a bit of a challenge because we do represent many, from a broad spectrum, a great mosaic of organizations, of individuals working in international health, but really as many of us as are represented in this room even, our paths, our expressions of faiths are unique. So this is something that we have been challenged by, but interestingly, it's not something that we worry about or obsess about. And so far, it hasn't gotten us in trouble, right? But what we focus on is our common ground, because what we feel we have in common is far greater than anything that could possibly separate us. Christ is our center. In Christ, we are one body. And as you recall in Ephesus, when Paul was talking to the early church there, that was a crossroads with much diversity and much disunity. And he says to them, make every effort to keep the unity of the Spirit through the bond of peace. There is one body and one Spirit, one Lord, one faith, one baptism, one God and Father of all, who is over all and through all and in all. And we have tried to keep the peace in our communion. Ray being a Mennonite, and that's what they're known for, so that's really helpful. But we try to also, as Paul says in Ephesians, to really be humble and gentle with one another, to serve one another with patience and bear with one another in love. We feel that Christ does not withhold himself from any of us, but we, being human, do often focus on what is different about us and can point to those things quickly. And our fears will often keep us from engaging one another completely. But we really believe that we must rise above this in our organization because of the power in this oneness and in our unity, because that's what will make us effective. And we need to rejoice in this, in our common heritage. That's what we're celebrating at this conference. The faith, those who labored before us, who created these health systems, whose shoulders we stand on now, where we want to sustain that. The world is changing around us. We're challenged as Christian agencies. As Meredith said, there was a time when it was really in to be an FBO, and now it's a bit more difficult. But we find that the more we seek His kingdom together, our diverse acts of service are much more, we find much more oneness and much more similarity in them than others would like to imagine. And our efforts at CCIH are carefully and prayerfully chosen to work towards God's purposes. That hasn't changed, Robin. And as Micah compelled us to act justly, to love mercy, to walk humbly with God, and to be a part of His plans to bring this health and wholeness to the nations. So it's this Christian perspective at CCIH that really compels us to also continue our networking, to advocate for the voiceless, the vulnerable, the forgotten, and to join together in conferences like this where we can share our equitable solutions for healthcare. And it's that unity that gives us this collective voice that we talk about. It's essential in our networking, it's essential in our advocacy work, and it's essential in our fellowship. It's what God would want of us. I truly believe that. And we are all focused on His perspective, not our own. And your presence here at this conference, knowing that we're a diverse group, that we're not one denomination here, is a real testimony to that common purpose that we're all seeking together, to do God's will and to follow the great work that's been done in His name in the past. So the work of CCIH is really based on this conviction that there's so much more to gain in finding our common ground than to preserve any divisions that might be pointed out. As Paul says in Romans, let's make every effort to do what leads to peace and to mutual edification. So that's what defines us. That is our perspective. And our hope is to serve our diverse membership with respect, with patience, and to really give thanks for the richness in that diversity that really becomes more diverse every year, wouldn't you say, Ray? And we're so proud of that diversity and the harmony that exists within our organization. There are many global gatherings, global health meetings that you can go to, and as someone said earlier, they just really feel they can't speak honestly about why they do what they do. But here you can really freely express what has compelled you to this work. And so I really encourage everyone over these 4 days to do that, just to let the Spirit have His way with you and to shout out why we are serving God in our efforts to bring health and wholeness and rejoice in our oneness. So I hope that over this weekend, you'll let Him who died for us draw us together in singleness of heart and really rejoice in that oneness. That's really our goal at CCIH, is to serve and edify those of you who serve in this international health community. And we hope that this conference will serve that need in you, to be able to share openly and with a family that has that common goal in their hearts and foremost. So thank you.
Okay, now we'll feel free to sort of discuss among all of us, but I'll start with a question that sort of bothers me. We were here in your presentation, sort of celebrating our Christianness using the noun that you coined. I'm not sure whether that's in the dictionary or not, but I think we all know what Laura meant by that. and we were talking about how our Christian faith, the Christian foundation, using the term that comes from our theme for this conference, brings a distinctive quality to our global health work. In the secular world, there are a lot of people who appreciate the distinctiveness and the added value that faith-based organizations bring to global health development. But there are a lot who don't very much. There's a very common perception in some secular circles and in many academic circles. I think I haven't done any systematic data gathering on this, that faith-based organizations, yeah, they're spiritual and so forth, but they're not very rigorous, they're not very scientific, they're probably not worth investing an awful lot of resources in. You know, they may be well-meaning, of course they're well-meaning, but in terms of implementing evidence-based practices that produce real results, they're not all that great. How do you, what do you say to that? If you're in a hostile environment and you believe that our spiritual, our oneness in Christ does make a difference, if you believe that the compassion, the spiritual direction, what were the other words? The permanence of faith communities does bring added value, why doesn't this come through to a lot of people in the secular world? How do you, any of you, how do you respond to that?
As you were talking, Ray, I was thinking about an example from China with Global Health Action. We've worked now in China in very strong partnership for 9 years with the Chinese government. And one of those groups is the National Population and Family Planning Association. And that's a group that, you know, has had issues with people, you know, questioning their motives, et cetera, et cetera. So there have been a lot of issues over the years. But it was interesting in that they chose to work with Global Health Action and with me as the leader, and I asked them about that, and they said it was because they saw our compassion, our view of the whole person. And then I found out later that when we were talking about that and plans for the future, one of their top leaders said to someone else, that's an organization that is based on Christian values and their leader is a committed Christian, so I know that their motives are honest, I know I can trust them. And so that's almost like the reverse, so I use that as an example. And I think it's true that some of us, for example, that are in the nonprofit sector, you know, we do have degrees in public health. We do know about evidence-based research, et cetera, et cetera. But maybe we're not totally proficient in it, or that's not what our primary focus is. So what I usually say to those groups is that the academic institutions need to partner with organizations like ours because we have the trust of the community. You know, we have the long history. We're there literally in the trenches working with people. It is the faith community in many of these countries and in these communities that are there year after year, day after day, when, you know, the political systems go up and down. It may be that, you know, the finances are there one month, they're not there the next month, but we're there. So what I say to them is, we have this set of strengths and skills and talents and beliefs, and if we combine those together, it makes a very, very strong program.